Welcome back. Yeah. It's Breakfast Daily on City TV. Thank you guys so much for staying with us. I thoroughly enjoyed that news review segment, by the way.
I mean, I think the submissions were great.
Yeah.
Now, if only they'll listen.
We have to. We have to get ahead. But it's the health segment now. We're talking about piles.
Yeah.
Cocoa. For those of you who
something that has really worried a number of people. I mean, I understand it's so very uncomfortable, especially the external ones, and it hurts that bad.
It's crazy. And I mean, Dr. Kelvin is going to walk us through some of the signs, the symptoms. True. And guys, there's no shame to it, okay? If you're experiencing something, you need advice, just send your messages to us and we'll ask him on your behalf. Use the hashtag Breakfast Daily and the WhatsApp line 0550585832.
True.
And we'll ask him all your questions. Dr. Kelvin, of course, he's joining us via Zoom, so we'll be waiting to hear from him as soon as he gets it sorted. But what has been some of your own, stories you've heard about people dealing with piles?
A number of them, and I understand. People go through a lot of pain, and it also has its own complications. It can result in a number of problems for different peoples based on their own genetic mode.
Yes. So when you gotta go, you gotta go.
Exactly.
The process of going shouldn't be so uncomfortable. Good morning, Dr. Kelvin.
Good morning, Shifa. How are you?
I'm great. Hey, what do you have in your background today? Some HD stuff.
Looks like Doc is using a green screen.
I like it. I'm used to seeing the motivational quotes behind you, but today...
But I still wonder, I'm seeing work hard somewhere.
It's still motivation.
Thank you so much for joining us.
Thank you for having me.
Are you sure you're in Ghana, though?
Yes, I'm live in Accra.
So, pals.
I'm creating my own heaven,
Oh, I love it. One of these days we'll join you.
You should.
Now, tell us a bit about piles, because most of us know piles as cocoa. What exactly is it?
Well, you see, when you call it cocoa, it gets a bit confusing, especially for us as medics, because in Ghana, cocoa can represent almost everything from eye disease to toothache to skin itching to hemorrhoids or piles, which we are going to discuss today. And so that's the challenge. A lot of people allude cocoa to so many different things, so many different health issues that they already have. But basically, we are looking at piles. And the medical name for piles is hemorrhoids. So if you went to the hospital and you think you have piles, the diagnosis they'll give you would be hemorrhoids. But essentially, these are engorged blood vessels. Yes, they are blood vessels. And so that's why one of the symptoms that you encounter when you have piles is that you notice blood in your stool. So piles are blood vessels that have become engorged over time. And I had to mention external ones, which means that he has some knowledge about piles. I don't know if he has any though. But there's the internal piles and there's also external piles. Most of them actually begin internally, and as it gets bigger or as it gets more severe, it protrudes outside of the inner region, and then it shows out as the external piles or the external hemorrhoids. So there are various degrees of hemorrhoids. I mean, from stage 1, stage 2, and all sorts of things. It's just to try and classify the severity of the hemorrhoids. And it's quite common, actually. It's very, very common, especially in our should I say, in the black race, because it's something that it has to do with family history. There's a genetic component when it comes to piles. And so a lot of people, it runs in family. So if your mother has or your father has it, it's most likely you're going to get it as well. But we also predispose ourselves to piles by our actions or inactions. And so I'm going to just list a few of the things or the factors that predispose a person to getting piles. And if you are female, a lot of the times you really don't have a choice about these piles, because once you get pregnant, most likely or invariably, you will develop some piles. This is because when the baby is growing, the weight of the baby is sitting in your abdomen, it's pressing down on your pelvic organs. And your pelvic organs include your bladder and other structures inside the pelvis. And included in these structures are blood vessels. there are a lot of large blood vessels in your pelvis, and these blood vessels supply the inner region, they supply the legs and all that. So they are very large vessels. When you have such a large item, baby, developing inside and growing inside your abdomen, it puts pressure on the blood vessels, and so it causes the blood vessels around the inner region, the anus, to begin to engorge because the drainage is impaired. Once this happens, we will develop the hemorrhoids or piles. So pregnancy is one of the most common predisposing factors for women. And another predisposing factor for women is fibroids. If you have a fibroid, especially if the fibroid is really large, it's going to sit in your pelvis and exert the same pressure that a developing baby would have exerted in the pelvic region. So it results in the hemorrhoids developing. Another group of people who could develop hemorrhoids are people who do weightlifting or gymming, as we call it. Because every time you lift the weight, you increase your intra-abdominal pressure. And if you're not putting precautions, one of the precautions to be the belt. There's a belt you're supposed to wear when you're lifting heavy weights. If you're not wearing this belt and you're just lifting the weight, you're increasing your intra-abdominal pressure and forcing things down. And so it's going to push your blood vessels down and then develop hemorrhoids. If you don't do anything about it, if you don't correct the wrong posture or the wrong lifting technique you're using, it's going to get worse and worse. Another thing that all of us in today's world are doing, which is causing hemorrhoids to develop, is sitting on the loo too long because of the phone.
Oh, wow.
A lot of people go into the loo and we are reading our messages there, we are responding to messages, we are doing Facebook and social media. So instead of spending 2 minutes or 5 minutes in the loo, you end up spending 10 minutes, some people spend 15, even 30 minutes in the loo.
Wow.
As you keep sitting on the toilet, there's gravity acting on your anus. And it's pulling your blood vessels, it's making them engorge. And so if you keep doing this over time, you are going to develop hemorrhoids as we speak. And if you already have the hemorrhoids, it's going to get worse because you are perpetrating this aspect. Then the final predisposing factor I want to talk about is our diet. A lot of us are eating too much processed food, and that is preventing us from moving our bowels often. We don't have enough roughage or enough fiber in our diet, and so it's causing us to be constipated. And because you're constipated, you end up having to force your stool to come out. You literally have to, at this stage, you chimp for the stool.
Oh, Dr. Kelvin, what's the English word for chimp or the medical word for chimp? Since you found it convenient.
Before the stool comes out, and because you are straining, you are causing, and because the stool is hard, so the hard stool with the straining will force the walls of the rectum or the anus to push the blood vessels to come down. So all of these things will contribute to you developing a hemorrhoid, or if you have a hemorrhoid, it's going to cause it to worsen.
So we're looking at a picture right now that has first-degree piles, second-degree piles, external pile, and then on the other side we have the rectum, we have the anus, we have the anal cushions. What exactly is going on? If you can explain what we're looking at for us.
So it's just giving you an idea what the different kinds of piles are. Some of them, like I said, they are small, they are first. There's a certain line. There's a certain line in the anus. I mean, it's an imaginary line, but we medics use it as a reference point. And so depending on the location of the hemorrhoid, above or below this line, it tells you what kind of degree you are dealing with. And as the hemorrhoid gets bigger, it can protrude. So as you can see, there are some that start on the inside and become external over time. So this is just giving you an idea of where the hemorrhoids could be and how big they could be. Some of them can actually get much, much larger than this. And so sometimes there are people whose hemorrhoids, like that, you can see that they protrude outside of the anus.
So so when you begin to see it, does that mean you're at the 3rd and 4th degree?
Well, yes. If you begin to see it, if you begin to protrude outside of the anus, then you are in the higher degrees, the 4th degrees and all that. And sometimes they come out, they literally come and stay outside, that you literally have to push them back inside. Because the thing is, if it stays outside, because it's not meant, the cells covering the hemorrhoid is not meant to be outside. The outside environment is not good for it. And so if it comes outside and it stays outside, it can become ulcerated. What I mean by ulcerated is like it can form a wound. And that's when it begins to bleed severely. It can get infected, and that infection can be severe because it has direct access to your blood vessel, which means that the infection can spread throughout your body. And so it's important that if you have a hemorrhoid, especially a severe form of hemorrhoid, you need to have it attended to. Let me digress a bit. Okay. Some people say that when they do have hemorrhoid surgery, the hemorrhoid comes back. And so because of that, they won't do any surgery at all.
Yeah.
Now, here's the thing. From the picture that you showed earlier, you will not have one hemorrhoid at a time.
Okay.
But it does not mean that we need to operate on all of them at the same time, because it might be difficult to reach some of the higher ones. And so if you have surgery for a hemorrhoid that was bleeding today, it's likely that maybe in the future, a different hemorrhoid, which was not bleeding at the time, or which was very small at the time, could become bigger and then now begin to show symptoms. It does not mean that the surgery has failed, or it does not mean that the person didn't do a good job. It just means that a different hemorrhoid has popped its head, and so we have to deal with that as well. And so do not say that because I did surgery for hemorrhoid and it has come back, I won't do it again. If you don't remove that hemorrhoid, you are going to have issues because you're going to continue to bleed. And once you are bleeding, you're going to have issue with anemia. You're going to have issue with work intolerance and all sorts of things. So hemorrhoid is really a small thing that can affect you significantly. So the earlier you deal with it, the better. Because the symptoms are very, very, very upsetting. For instance, one of the most upsetting symptoms, apart from the bleeding, is itching. You can have very, very itchy anus. I mean, it can itch so bad.
Should you scratch it when it's itching, or it's better to leave it alone? I know this is a bit individual, but
sometimes you might not have a choice. You would obviously have to scratch them.
But would you damage it if you scratch it because it's sensitive?
Exactly. You might not have a choice. You may want to scratch it, but here's the thing: because the cells are so fragile, if you go and scratch it, it could tear through, and then now you start bleeding. The bleeding from a hemorrhoid can be very, very severe, And the other symptom is pain.
Yeah.
The pain from hemorrhoid, you cannot do anything. You literally, you can't sit, you can't stand, you can't lie down. It's very, very frustrating. Yeah. And so, in fact, I have attended to a patient who has had the thrombosed hemorrhoid. When we see the hemorrhoid is thrombosed, sometimes when it comes out of the anus, and it stayed out, it can actually become the blood inside the hemorrhoid can become thrombosed, can form a clot, and that is excruciatingly painful.
Wow.
I mean, all the times I've seen patients who've had a thrombosed hemorrhoid, it has not been a funny situation at all. Wow. They can't sit, they can't stand, they can't lie down. It's pure frustration.
It's crazy. Now, Doc, please, wrapping up for us, how do we prevent piles, if that's possible, because you said there was a genetic component to it, and how do we also treat it?
Yeah.
Okay, so first of all, if there is a family history of hemorrhoid, it means that you're not necessarily able to do much about it, but you can reduce the probability that it will start. And even if it does start, you can slow down the progression. And so some of the things you need to do is, number one, watch your diet. As much as possible, increase the fiber content in the diet. Take a lot more natural fruits and vegetables. Sometimes we drink the box juice, but those box juice have been processed so much that the fiber content is really good. So take natural fruits and vegetables to increase your fiber content. Eat more brown rice instead of polished rice, and the likes of those things, because that helps your bowel to move more frequently and softens your stool. Number two, if you are overweight, you need to lose weight, because fat also causes weight and increase the intra-abdominal pressure. Imagine you have all this abdominal fat, belly fat. It's sitting in your pelvis, it's pushing your piles down. So losing weight is also critical. If you go to the gym, try and put the precautions in place, wear the belt, and then lift weight at your appropriate tolerance level, and use the correct posture so that you don't develop a hemorrhoid as a result of that. And as much as possible, you need to also plan your family. Family planning is important. Family planning can help reduce the incidence of hemorrhoid, because if you are getting pregnant too frequently, obviously, if you have hemorrhoids, you're going to wear sleeves. If you don't have it, you're most likely to develop it. So plan your family, space them out, and you will get better outcomes. And so these are some of the things you can do to reduce the incidence of hemorrhoids. And if you do have hemorrhoids, have it attended to and treated. Because if you treat the hemorrhoid before it becomes a problem, number one, it doesn't cost as much, and number two, you don't spend too long in the hospital. But if you wait for it to become complicated, then your length of stay in the hospital is going to increase, and the cost of intervention is also going to increase. So as much as possible, deal with the hemorrhoids quickly so that it doesn't become an issue. And if you've had hemorrhoids early before, you are having a recurrence of a different hemorrhoid, again, please have it attended to because it needs to be attended to. Otherwise, you're going to have complications, one of which is anemia. Anemia in hemorrhoid is very, very critical, especially, and in fact, if you're a man and you're anemic, one of the first things we check for is hemorrhoids because anemia is one of the most common causes of hemorrhoid is one of the most common causes of anemia in men. So it's very, very important that you take note of these things and have them attended to.
Because you're losing blood, right?
Yeah. All right, Doc, thank you. Thank you so very much, Dr. Kelvin. We're so grateful for that education on PALS. Yeah. So he mentioned it, excruciating pain.
It is.
So,
please, whatever you can do to avoid it, please do it. When you get it, there's no shame to it. It's very normal.
Yeah. Early
See a medical doctor
early
and get
treatment, always. Yeah.
You'll be just fine. We hope you've enjoyed the show.
Make sure you subscribe, like, comment, and share with your friends.
This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.